Hello and welcome to 12 to Your Health. I'm your host, Dr. Derek Da Silva. Drawing blood or establishing an IV feed are the most common invasive medical procedures. It can be a painful experience when a doctor or nurse struggles to find your vein and ends up sticking you multiple times. Even worse for patients afraid of needles. A new technology is improving the process by making it much easier to locate veins. Here to show us how it works is Ron Goldman, CEO of AccuVein. Thank you very much for joining us today.
Thank you for the invitation.
So, drawing blood, I am petrified of needles. I really am. And there are a lot of people out there who are very afraid of needles. This whole new technology is revolutionary in the field of drawing blood, is it not?
It sure is. You know, one of the most common fears people have going to the hospital, even if you're going for a very aggressive procedure, they have overwhelming fears about the blood draw, the IV and the drawing blood.
Well, a lot of people won't get blood work drawn on a regular basis because they're afraid of the whole needle stick and that whole procedure.
Sure. You know, today the only tools you have available as a practitioner is your finger. You are feeling for the position of the vein. With the AccuVein 300, you actually just shine it on the arm and you see a roadmap of the vasculature.
Well, we've got some video. Oh, here we go. Here it is right here. Can you just comment and tell us exactly what's going on here?
Sure. The device is armed at the arm, and infrared light is detecting the position of the veins, and we are then projecting with red light the vein pattern. So essentially you have a roadmap. The practitioner no longer has to guess where the veins are. And as a net result, we're finding that they are able to access the vein much more frequently. The statistics are, with adults, they miss more than 30% of the time, and with pediatrics and neonates, they miss more than 50% of the time without assisted technologies.
Wow, and that can become extremely uncomfortable. And folks, you're probably wondering why I'm sitting here with no jacket on, with my sleeves rolled up. It's because we're going to do a demo, which you're going to do right now. So show us how this works. And I am going to roll my sleeve up and show it to us.
You'll notice that you don't see the veins without the device.
Right.
Simply press the button and shine it on the arm.
Wow.
And you immediately see the vasculature.
You can move it down now. Show it's. Wow. Amazing. Now, here's the other thing that, let me bring it up a little bit more. What I would like to see here is, you know, when you stick when you're drawing blood or putting an IV in and the vein splits or bifurcates, putting it in the right spot is extremely important, is it?
That is correct. You see a bifurcation.
Or a splitting right there.
Or splitting right at this point.
Right.
So you would want to go a little south of it.
Right.
So that the needle has a nice straight run.
Right.
Additionally, a practitioner with our device can see the position of the valves, and you do not want to put a needle through the valve.
Now, what does that mean?
A valve prevents the blood from flowing, from back
and that's why sometimes you have to pull the stylet back, right?
Back.
Right.
So with our device, you can detect the position of the valves and avoid the valves in your stick.
Wow. So you would want to put that right here. Or let me get my pen here to see if we can do that. You would want to put that needle, right about here?
Right about there, yep.
Right, and then bring that in. And if you're drawing blood up here, you'd want to go right into this vein right here, right?
And what we're finding from a patient satisfaction standpoint, we've polled patients, and what we find after the device is used, they're willing to drive up to 15 miles in each direction to go to a facility that has our device versus one that doesn't have our device.
Well, I got news for you. I would drive 30 minutes, okay?
Very good.
Because I'm telling you, I mean, people are really, my son, my older son, for example, is terrified of needles. So to try to get him to do blood work is just unbelievable. So who typically, and where are you using this technology? Is it in labs? Is it in hospitals? Where is it being used?
You know, blood is drawn everywhere, so the market available to us is extremely broad. But we've started our sales primarily in U.S. hospitals. We're in over 1,000 U.S. hospitals already. We sell in 90 countries around the world. So, you know, tremendous progress to date. And what we're finding is two things. We talked about patient satisfaction, but the other element of the equation is savings for the hospital. When you miss a vein, you then have to go and escalate to another nurse or another practitioner, tying up the hospital. With our device, your ability to get in earlier just saves a lot of time through the process. we're finding that even though our device sells for $4,500, hospitals are often getting a return on an investment or paying for that in under 3 months of savings.
Right. They're going to come back and they're going to tell their friends and do this and not be afraid to go there and get the blood work done.
That's for sure.
Thank you very much for joining us.
Thank you.
There's lots more to come on 12 to Your Health. Later, we'll talk about the health benefits of going gluten-free. It's not as difficult as you might think. And after the break, you don't want to end up sick on your next vacation. So we'll tell you how to fly healthy and avoid all those germs waiting for you on the airplane. But first, your Health Bite of the Week. Here's some foods that may be able to help you fight the flu. Welcome back to 12 to Your Health. I'm Dr. Derek De Silva. If you're looking to escape winter for a warmer destination or jet off to the ski slopes, the last thing you want is to catch a cold or a flu on the plane, which could ruin your vacation. Here with some tips on how to travel safely and keep the germs at bay is Dr. Michael Rothman, an internist specializing in alternative medicine at MD Wellness and Spa in East Brunswick. Dr. Rothman, welcome to the program.
Thanks. Thank you for having me, Dr. De
So
Silva.
when we talk about planes, you know, everybody has this perception of, oh my God, they're dirty and there's stuff in there and I'm going to get sick. Is that true?
Well, the statistics show that there's a much greater chance of catching a cold and or a virus around the time that you've flown. So yeah, there is a certain truth to that.
And but why? You know, what is the issue when it comes to that? What are the risk factors, if you want? I hate to say it that way, but what are the issues?
Well, we have people that are packed together in such a small area, and a lot of the area is recirculated as well.
Mm-hmm. And you know, there are some tips that you brought us, and the first one is eat immune-boosting foods before you fly. What are some of these foods?
Well, I would actually turn that around and say try to avoid eating foods that are actually bad for you. There's a lot of immune-sucking foods, so to speak, sugars, fried foods, vegetable oils, junk food, so to speak. And people, when they're in a rush and they're flying, oftentimes will be eating these very poor quality foods. You
know, I tell people that the worst thing that you can do is to eat a meal at the airport before you leave to go. I have to tell this story very quickly. I was in Florida last week and I ordered some food, all right? I ordered some food and I said, skip the French fries, give me some fruit. Lady looked at me and she said, that'll be another $2.50 more. I said, that's fine, no problem. But a lot of people will say no to that and take the French fries, which is the worst thing that you can eat.
Agreed, 100%.
But and what I'm trying to say here is that eating well sometimes ends up becoming more expensive, which we'll talk about some other time. But the other tip that you have is avoid the pillows and the blankets on the plane. Why?
Well, you have to worry about the hygiene involved there and whether or not these are actually thoroughly cleaned. And they're going to come in close proximity to your face, and you know, your mucous membranes, your mouth and your nose and your eyes. This is where you're going to catch the cold. So it's very, very important to keep those areas clean.
The next one is cough and sneeze properly. And again, there is a proper way to cough and there is a proper way to sneeze. If you could just show it, what's the right way to cough and what's the right way to sneeze?
Well, this is actually more for the other person's protection than your own, but if you were going to sneeze, perhaps you want to sneeze into your arm or your elbow, or with a handkerchief into your hands.
Right.
Yes.
And then if you don't use a handkerchief and you sneeze into your hands or cough into your hands, don't rub your hands on your pants, go into the bathroom and wash your hands. That's the other thing. Stay hydrated, really important.
Yes, and you want to drink water. You don't want to be drinking caffeinated beverages or sugary beverages. Water is really the most important thing.
Right. And then sugar. We mentioned sugar already. Avoid the sugary beverages.
Absolutely.
Why?
It's so bad for your immune system. It's so bad for you. It will dehydrate you. It'll actually make you more thirsty. These are really liquid poisons that I advise people to avoid in all situations, not just when they're traveling.
And the next one, the next tip is washing your hands frequently. Just makes sense. And
right,
why is that so important?
Right, because you're going to transmit. If you do touch something that has a virus on it and you accidentally touch your eye or your nose or your mouth, that's how you're going to catch the cold or virus.
Just regular soap, that's your recommendation when you're washing your hands, just soap and water, you don't need to get fancy?
I think that's adequate, yes.
And then if you don't have something, you can always use some of the Purells and some of those sanitizers. You're okay with that?
Right, those are fine.
Okay. This other one is a little bit more common in the Far East, where people wear the masks. They wear the covering your nose and your mouth. It's not as much in this country. What are your thoughts on that?
I think if you really have if you're a weak person, if you have a bad immune system, if you're very prone to these things, it may be worthwhile for you.
Now, and this other one I have actually seen on the plane, and that is to use a personal ionizer. And you brought one here with you. Can you just talk a little bit about this and what this actually does?
Well, you would wear it right around there.
Right, it's something that would go around your neck.
And the air, it actually ionizes, meaning it puts a little electrical charge into the air, and that electric charge will neutralize the viruses in the air. So the air that you breathe is actually being cleaned.
So this is a personal thing that cleans the air right around you. No health risks or no issues with this at all?
Not that I'm aware of.
Okay. What about the things like coldies and some of those things when people start to get sick? Real quick, we've got about a couple of seconds. What are your thoughts on that?
Well, coldies has been shown to reduce the length of colds by 42% through the Cleveland Clinic. It actually works in a similar way as the ionizer, because the special form of zinc in there will actually become ionized and keep the viruses from adhering to the nose.
Thank you very much for joining us. Still to come, the health benefits of going gluten-free. Will tell you how to do it. But first, here's a look at this week's Community Health Calendar. Welcome back. As many as 30% of Americans have a sensitivity to gluten, which includes gluten intolerance and celiac disease. Having this or any other allergy can make managing one's diet difficult, if not impossible at times. Here with some advice on choosing foods that are gluten-free is a contributor to the Cooking Light Gluten-Free Cookbook. I'd like to welcome dietitian Janine Whiteson. Great to have you here.
Thanks for having me.
I love when we have all these really pretty things on the desk here. You know, when I hear gluten, the first thing that comes to my mind is gluten, celiac disease. Novak Djokovic, I don't know if you're familiar with him, tennis player that has completely changed his diet, completely changed his life, and is at the top of the tennis world right now.
It's unbelievable how gluten can severely affect one's life. I mean, gluten is a protein found in wheat, barley, and rye, and it's hidden, really hidden, in processed and packaged foods. And we need to kind of figure out what is safe to eat and what is not safe to eat.
Well, we hear the terms gluten, we hear the word celiac disease. You know, we have all of these terms. Can you put them into perspective for me?
Sure. There is celiac disease, which is an autoimmune disease where the gluten actually damages the lining of our small intestines and nutrients cannot be absorbed. That can cause nausea, vomiting, again, damage to the intestinal system. And then there is wheat allergies, which is an actual allergic condition, which can cause hives, swelling, difficulty breathing, and intestinal issues as well. And then there's gluten sensitivity, which is very similar to celiac disease, but it isn't a disease. It's not autoimmune, but it still has the same symptoms.
How do we make the diagnosis? Because, you know, we hear these things, and for many years I've heard this in my own practice, and it seems almost, it doesn't make any sense, but it does make sense.
It completely makes sense. Listen, I've been a nutritionist for over 20 years, and again, at first I thought, oh, this is hocus pocus. But after treating literally thousands of people with issues, digestive issues, gas, bloating, nausea, vomiting, a failure to thrive in little children, and it can happen in 3-year-olds, it can happen in 80-year-olds. It really makes a huge difference to take gluten out if that's what you feel is going on with your system.
So you have some tips for us on going gluten-free.
Yes.
And the first tip is check labels, and that's, I would imagine, right here.
Yes, well, it is vital to check food labels when you're going gluten-free, because gluten can show up in products, which is shocking to see, in soy sauce, in chocolate, in icing, and even flavored teas. So in
flavored teas?
Flavored teas. In our Cooking Light gluten-free cookbook, we show you the products to be careful of. It's really a whole education. You need to educate yourself, your family, your children, the grandparents who may be suffering, you know, to where it is in the supermarket.
I was in the supermarket the other day, and I always hear this, shop the perimeter, which is your next tip. And I was kind of in the middle, and I thought, I better get out of here. Let me go to the outside.
Go to the outside.
Is this shopping the perimeter?
Yes. The inherently healthy foods, such as fruits, vegetables, the gluten-free grains, fish, dairy products, it's all on the perimeter of the supermarket, and that's where you're going to get the bulk of your food from. Things like oats, they are gluten-free, but do not buy it in bins, because there could be cross-contamination. You need to buy
cross-contamination
with other wheat, barley and rye and other cereals.
So how do you suggest we buy it?
We buy it only in packages that completely say gluten-free on it.
And your next one is stock up on safe staples.
Yes.
Like what?
Like cereals that say gluten-free, that are rice pastas that are made from quinoa, which are great whole grains, or buckwheat, which is actually a seed, not wheat, just to make that clear, and other pastas as well. There are large amounts of gluten-free products now in the supermarkets that are healthy for you, that you can go for.
Well, the other thing is I wanted to show that these packages do say gluten-free on them.
Exactly.
Right? And that's what you're looking for.
Yes.
But here's one other caution that I think we need to be aware of, and that is how much sugar and how much salt is in a lot of these products, because we need to be able to read the labels. I want you to come back one day and teach my audience how to read labels.
I would love to do that. We can take a
what about
segment
the labels?
Well, it's very important to read food labels. Again, in the gluten-free cookbook, Cooking Lights, we show you all the labels that you need to know. Call the manufacturers if you don't think it's gluten-free or you're not sure. And don't forget, manufacturers are constantly changing food labels, but salt and sugar is extremely important to look for as well.
And last but not least, as we come to the end here, keep a clean kitchen. That almost makes sense.
Yes, but not a lot of people realize if your daughter, your son, or a father has to be gluten-free, you have to keep your kitchen safe. Buy 2 peanut butters, make 1 gluten-free, so nobody touches with a crumb-coated knife, okay, because that can cause a flare-up. Also, don't use wood or bamboo cutting boards, because they're porous. And crumbs can get in it, and somebody, again, could get nausea, vomiting, if there's a gluten or a non-gluten product on it.
Thank you for joining us.
Thank you for having me.
Great information. If you have any questions about anything you've seen on our show today, email them to us at 12toyourhealth@news12.com. Thank you for watching 12 to Your Health, and until next time, I'm Dr. Derek De Silva, and may you always be blessed with good health.